y'all, welcome back to another video. It is your girl Nurse Mimi and I'm back with another video. It's been 2 weeks, I know. Oh, I'm so sorry for those of you who cannot keep up with me. I'm sorry, and I just hope that whatever I do can help you in one way or the other. I know we all have schedules and we have those for our NCLEX exams, and I might really be coming right behind the time. But I trust me, if you had watched any of my videos, you must have picked out one or two things that will help you take you to that pass level. And I pray for you honestly to make it through with this NCLEX thing and start earning the money, of course, Um, Thank you so much for my returning subscribers. We are at 27 subscribers. Oh my God. Thank you so much, y'all. This is amazing. Like, we started with 0, 1, 2, 3, and now 27. That's interesting. I like that. I like to see those subscribers coming in. When I wake up every morning and I turn to my channel, I see that one person or two people have added. I feel so blessed. So blessed. Thank you. Thank you so much. And please keep subscribing, okay? Because like I said, we're not just going to be doing NCLEX things on this channel. I have a lot more interesting content to bring on the table once I'm done with this NCLEX tips and all of this. So I'm going to take you all on my journey from the beginning to the end, and hopefully you get to know me even better and I get to know you guys better. And it's actually my pleasure, it's my decision to take you guys on my journey as a nurse and as an NCLEX passer. What next? What next? What next? What next? So just stay tuned, keep subscribing. Please thumbs up to this video, because some people get to see it just because some people thumbed up the video. So when you like the video, YouTube pushes the video for other people to see. That just means that it's interesting. So please don't forget to like, okay? Share it and comment. Drop those comments. I like to see those comments. Please drop them, okay? Not to waste so much of our time, let's get started. So last 2 weeks, I talked about the endocrine system, whereby I mentioned the very first gland, which was the thyroid gland, and the reason why boards really like to test on the thyroid and the adrenal cortex, which we are going to see today. Okay, so in the endocrine system, there are so many glands, but boards only focus on these two. So far, they focus on these two, and the reasons are so obvious. Look at thyrotoxicosis, thyroid storm. If you don't intervene properly in like 2 minutes, you're losing the person. So why would they not focus on that? And today you equally see why they have to really focus on the adrenal cortex as well. So to begin, we need to know, like, what does the adrenal cortex gland do for the body? So it secretes hormones that control salt levels, controls sex, controls water, glucose, blood levels. All right, so we will look at the first disease, which is Addison's disease, and you will see how this gland, okay, actually helps us to overcome certain problems that if you do not have the right quantity of this hormone, you're going to suffer from something which is called Addison's. Okay, you will see why and how this adrenal cortex gland is supposed to help us, but people who suffer from a deficiency of this hormone actually suffer from what they suffer from. Just stay tuned, please. Forget my grammar, okay? I know I'm not a professional YouTuber. I just sit here in my lazy environment, boring stuff, but I tell you guys something that if you really pay close attention to, it will help you with your NCLEX. So don't forget that. Now that we know that the adrenal gland helps us with blood level controls, sugar level controls, salt controls, and all of those other things, let's get into Addison's. Just from the name Addison's, If you're adding, it means something was missing or something was low and now you need to add, right? So Addison's disease is an under secretion of the adrenal cortex. Under secretion. Under. So whenever you see Addison, just refer to it as if I'm adding. It means something is missing or something is less. So Addison means under secretion of the adrenal cortex. So if someone presents to you who is suffering from Addison's disease, how would you know? We are now diving into the signs and symptoms. They are hyperpigmented. That is, they are very tan. Imagine some people work so hard to tan their skin, but people with Addison's disease, they just get it like that. They're tan, okay? Hyperpigmented, and they look really tan. And the second thing that is interesting about them is that they do not adapt to stress. So the first sign is they are hyperpigmented, that's very tan. And the second thing is they do not adapt to stress. This is a big thing, okay? Please pay special attention to this explanation because you see it in your exams or in UWord or wherever you're doing questions, you will find these things because they are very common. They don't adapt to stress. Let me explain. You and I who do not suffer from Addison's disease, when we are stressed, the brain is the part of the body that's affected, right? And so when you and I are stressed, we have our normal adrenal cortex secretion. A normal level of these hormones are being secreted for people who are not suffering from Addison's disease. So when this is secreted and you undergo stress, what happens is that these hormones will increase the perfusion of blood to your brain by increasing your blood pressure, and they'll equally increase the glucose that goes to your brain by increasing your blood sugar levels. You get that? Let me take it all over. You and I who do not suffer from Addison's disease, right? When we undergo stress, we have normal levels of this adrenal cortex hormones in our system because we are not under-secreted, right? So when you and I undergo stress, this is what happens. The brain, okay, needs to be perfused and needs to get enough glucose to, overcome this stressful situation. So what happens is that when you and me undergo stress, the adrenal cortex has a job to do, which is to help increase the perfusion that goes to your brain, and it does that by increasing your blood pressure level, not blood pressures. And the second thing it does is it increases the glucose that goes to your brain by increasing your blood sugar level so that you can overcome the stressful situation and calm down, okay? Now, for people who suffer from Addison's disease, remember we said they don't have enough. They are under-secreted, so they don't have enough of this adrenal cortex hormone. So when they suffer from stress, what happens to them? There is no enough adrenal cortex hormone secretion. So their brain will have to suffer because they don't have that hormone that will cause an increase in blood perfusion by increasing blood pressure, or the one that will help them to increase blood glucose level that goes to the brain by increasing blood sugar levels. So they don't have these things. That's why they do not adapt to stress. Remember, when you are stressed, when I am stressed, my adrenal cortex has a job to do. Their job is to secrete these hormones that will go and increase the perfusion of blood that goes to my brain, thereby increasing blood pressure levels. They also help more glucose go to my brain by increasing my blood sugar levels so that can help me get out of the stressful event. But people who suffer from Addison's disease, when they are going through this terrible situation, they don't have enough of this adrenal cortex hormones to help them perfuse their brain and send more glucose to their brain. They don't have those. So what happens to them is that they will suffer when they undergo stress. Most of them will just pass out. Yeah, when they undergo stress. So stress is a thing you do not want to see these people go through. You don't want to even put them in that position. You see them go for a dental checkup or something and then they pass out. The least form of stress for these people is dangerous. Okay, it's dangerous, which is why Addison's disease is really rare and scary. It is rare. Imagine someone who cannot take on stress. It's scary because we live in this world where we stress every day, every now and then. The least thing will stress you up. Maybe one or two things that didn't work out will stress you up. And then imagine you have a condition like Addison's, and this your own stress level doesn't even have the backup of adrenal cortex hormone to help you. How would you really survive? That's why God said it's gonna be very rare. So you will hardly find people with Addison's disease. Okay? But it's good you know, because if you know, you'll be able to help keep them away from stressful situations as much as you can. Or you have to know what to do when they are undergoing stress. Okay? All right. So the first thing I said about them is that it is very scary. The second thing is that stress is the most dangerous thing to people with Addison's disease. Stress is the most dangerous thing for these people. So you'll find this knowledge in one way or the other in your exam. Okay? Treatment. So when we see this dangerous thing, we need to know, oh, what can we do to help these people? Of course. So that's why we're going straight into the treatment. You give them steroids, glucocorticosteroids. And steroids are all drugs that end in son. The son is spelled S-O-N-E. So every drug that ends in son is a glucocorticosteroid. Example is prednisone, betamethasone, and all of those. So this is the treatment for Addison's. You give them this glucocorticosteroid. Okay, you give them steroids. So from the name Addison's, if you understand that Addison's means you are adding because they lack something. So for you to easily understand the concept is, when I see an Addison's patient, I need to add a son to them. Add a son. Add stands for the disease condition, which is Addison's, and then son stands for the treatment that you're giving them. Okay? Add a son tells you everything about Addison's disease. You get that? And what is a son? They are steroids. So that's how you treat these people. So what happens when they are actually undergoing stress? You have to increase their dose of the steroid so that it can help fight the stressful event. Because these people, they normally take these steroid medications for just because they are low on this adrenal cortex hormones. So when they are undergoing stress, it's even worse. So you need to do what? Increase their dose of this of the steroid to help them fight the stressful situation and come out of it alive. Okay? All right. So like I said, these people, when they undergo stress, they can easily go into shock. They can go into shock easily. So you have to really take note of people who come in with this condition. Like I said, it's rare, but it doesn't mean that it doesn't exist. It's scary and rare, and there are people who actually have this condition, so you need to watch out for them. Let's go to the second disease condition under the adrenal cortex, which is Cushing's disease, Cushing's syndrome, Cushing. We looked at Addison's, and we said with Addison's, you're adding because they don't have enough of this secretion. So with Cushing's syndrome, we are looking at these people who have a lot, that's over secretion of the adrenal cortex. They instead have too much. So same like Addison's, which is they have less. Cushing's, they have too much over secretion. You know, a lot of or too much of everything is not good, so you just have to be on a balance. So this Addison's people, they had under secretion of this hormone, and Cushing's syndrome, they have over secretion of the adrenal cortex, which is also a problem. So signs and symptoms of a Cushing's disease is it's a Cushing man, okay? So for you to memorize signs and symptoms of Cushing's syndrome, you need to be able to know how to draw the Cushing man. I call him the Cushing man, okay? Cushing man, because the Cushing man, if you're able to draw him, memorize the signs and symptoms, the things you see with this man, then you're helping yourself answer two questions. So if you can draw the Cushing man and know the signs and symptoms of a Cushing man, then you'll be able to know that these are equally the side effects of steroids. Side effects of steroids are the signs and symptoms of a Cushing man. How is that possible? Simple. Remember, Addison's means that you have less of this hormone, so you're going to take what? Steroids to be able to have enough of it for your function, right? And Cushing syndrome says that this man has over secretion. So what happens when you take a lot of this steroids? For Addison's, when you take a lot of steroids to treat your Addison's disease, it's going to lead you into a Cushing man. You get that? So when you take a lot of steroids to treat your Addison's disease, it's going to put you at the position of a Cushing man who now has over secretion of this hormone. So it's like a cycle. It just goes in cycles. If you treat this condition, it leads you to the other one. If you don't treat this one, you're back at the other one. You get that? So I'll show you my Cushing man. Please don't laugh. You can look him up on I hope you can see. You can look up Cushing man on Google, and then you learn how to draw him. Okay, I'll try. I don't know if you can see Cushing man. Yeah, I don't really know how to draw, but that's Cushing man. Look him up, try to draw Cushing man, and then if you know how to draw him and label him so well, then you'll be doing yourself two things, which are you'll be memorizing the signs and symptoms of a Cushing man versus the side effects of steroids. So whenever they give you a question that asks you for side effects of steroids, just go to signs and symptoms of Cushing man, and you got it. You're getting it right. And whenever they ask you for signs and symptoms of a Cushing man, just know that they're asking for side effects of steroids. This knowledge is very vital. I don't know how else to really explain this, but you will see this. They will ask you a question about the side effects of steroids, and it's very easy if you knew the signs and symptoms of a Cushing man. So a Cushing man has a lot of things going on with him, including their hair is very thin. They have thin hair. They have red cheeks. Okay, their cheeks are red, and they have a moon face. Okay, they have extra hair on their body and face. They have extra hair on their body and on their face. That is called hirsutism. All right, they have a buffalo hump. That's a fat back, a buffalo hump. They have gynecomastia. They have thin arms and thin legs. Thin arms and thin legs. They have central obesity. They of course, they are weight gain people. They are overweight. They easily bruise, okay? Easily bruise, or they bruise easily. They retain lots of water and sodium, thereby losing potassium. So they retain lots of water and sodium, and because of that, they lose potassium. They have purple striae, that's stretch marks, purple striae. And they say that they look diabetic, which means they're hypoglycemic, and they are immunosuppressed. These things I just said, they are found on a Cushing man. So if you're able to draw a Cushing man, you already know these things that I'm talking about. Learn how to draw a Cushing man. On your exams, when you get in there, just get your rough paper. If possible, just draw a Cushing man and label him, so that when you come across that question, you'll be able to just refer to him. Or what I did was I just memorized this in my mind, and I just had my Cushing man in my mind, so much so that when I saw a question on that, I would just, know where to find the answer. And if I was asked, like, in case you're asked side effects of steroids, just know that you're looking at signs and symptoms of Cushing man. And I said the reason is because, remember, for Addison's, you are under-secreted. So if you take steroids, it will take you to a Cushing man. So if you know the signs and symptoms of a Cushing man, you are equally helping yourself know the side effects of steroids. And you always get the questions right if you know that. So how do we treat these people who have over-secretion of the adrenal cortex? How do we treat them? There's a way we have to treat them, of course, because it's not a condition that you want to leave your patients on, right? You need to find a way to treat them. So one of the ways is adrenalectomy. Adrenalectomy. Here we are removing the adrenal gland. We're removing it. If you remove it, what do you become? You become an Addison's patient. That's why I said it's a cycle. You go round and round. People who suffer from overproduction or over-secretion of the adrenal cortex are called the Cushing, or they suffer from Cushing syndrome, right? Now, the way you treat it is by removing the adrenal gland. You do a bilateral or a unilateral adrenalectomy. Imagine that a bilateral adrenalectomy is done, which means your adrenal glands are taken away from you. So you go back to being someone who doesn't have enough, an Addison's patient. So if you're treating a Cushing man by removing the adrenal gland, you're bringing them to become an Addison patient. Okay? So, but now that's the way you treat them. Adrenalectomy. So, it's really a cycle that you go through over and over and over and over and over and over again. Someone who has Addison's, when you add a son that you add steroids to them, they look like a Cushing man. And then when you treat the Cushing syndrome or the Cushing syndrome, you're taking them back to an Addison. But then that's not even like what we should be looking at. We should look at Addison's. What happens to them is that they are under-secreted, so you give them a son, which is steroids. And you should know that they don't have that ability to overcome stress. So they don't adapt to stress. They can easily go into shock. Okay? And you have to know the signs and symptoms of the Cushing's syndrome disease, which is the same as the side effects of steroids. Okay? Wow, so that is it about the adrenal cortex. Trust me, if you pay attention to all these details, ignoring my flaws and just looking at what you're trying to get, you're going to be able to at least answer one question correctly. And what are we looking for on the NCLEX? We're looking forward to answering our questions and not fail anyone. And just having one question right is a milestone towards, the passing level. So the NCLEX has like, the algorithm is like, you have this line here. When you pass one, you're up, you're above the line. When you fail one, it takes you down. You pass one more, it takes you up, down, to the point where they determine if you're actually going to make it or if you're actually passing. For instance, you're up, you pass another one, you go up, and then if you fail one, you go one step down, one step down, one step down, one step up, one step up. So up to the point where they determine that this person is far above this passing line. So we have to just close up this session because he or she has already passed. Same with failing. So if you're down this line, you fail one, you go down. You fail another one, you go even downer and down and down and down. Okay, imagine that you just learned one thing from me, it takes you up, and then another thing from another session, it takes you up, and then you go above that passing line, and you're done with your NCLEX in your first try. Even if it's your second try, trust me, never give up on trying. If you really want it, you have to go for it, okay? You have to go for it. So this was Nurse Mimi, and please make sure to thumbs up this video. If you had anything confusing, please just leave a comment and I'll be very, very happy to come clarify you. And if there is any questions, also please leave your comments down below. I'll make sure to answer to every comment just like I've been doing. And please, you have to study to know your content and then go to answering questions, because I'm really advising you guys to do questions. Do a lot of questions. Reason being that in the questions you get to see like the techniques of the questions and how the questions will appear to you. When you get to familiarize yourself with those techniques, when you enter the exam hall and you see questions, you're going to be like, I know, because they will throw questions at you, the same question in different ways, but it's all asking for the same exact answer. So what you have to do is just look at questions as much as you can, study questions, use questions to study. Don't pay, like, what I did was, I listened to Mark Klimek, okay, and I took down notes because I really like him because his stuff is focused on the exam. After the exam, you can go more into knowing a lot of things about nursing as you practice, but for the exam purposes, I studied him, I took down notes, plus other sources. I was able to make these notes that I'm using for you guys today, and then I went into UWorld. I did UWorld as though I was crazy. I finished my Q bank, and then the questions that I failed, I had to go back to them to start answering them again. Even though I didn't finish the questions that I failed, but at least I finished my original 2,000 plus questions. And then I went back to the questions that I had failed. I started redoing them. And then when I was done with when I was done with the 2,000 plus, I took my first assessment. It said that I had high chances of passing, and then I started redoing the questions that I failed. And 3 days, was it 2 to 3 days? 2 days to my NCLEX exam, I actually took the second assessment, and it still said that I had high chances of passing. So what am I saying? Look at UWorld. or any Q bank that you're using. It must not be UWord, but make sure you answer as many questions as possible so you get yourself used to the question style. You understand? Because from what I did, UWord teaches you that they'll ask you the same question in different ways, but they're only trying to make sure you know that this is that same question that they're asking you in 1,000 ways. So don't forget to do questions. You do the content and do questions. Questions also help outline the techniques for you to use in answering them. Because if you do this question now and fail, you do it again in another way and fail, you do it the third time in another way, your mind will begin to be like, oh, now I see the trick. So the trick in the exam also is by doing questions. The more questions you do, the more exposed you get, and the more you're going to pass. Your chances of passing will increase. So from the people that I've known so far, I've known Mark Klimek to be super helpful. I've known you all to be interestingly helpful. I've known, I hear people talk about Mo, that he has interesting content as well. I don't know much about him because I use just two things to study for mine, Mark Klimek and UWorld. Those were it for me. There is also International Crusade, something like that. So they also are doing a great job because I watched them for some time. Like I watched like 2 or 3 of their videos before my exam, and they were saying some really good stuff too. So you can check them out as well. But above all, you need to pray, commit your session to God's hands, because I believe with him everything is possible. Everything. I mean everything, okay? Everything. So stay tuned to this channel, you guys. Please subscribe, like, share, and comment, because I'm coming back. And don't forget, I said that I'm going to learn how to do really great content, good camera. I'm just using my phone for now, but it's okay. As long as you pass that exam, that's good I'm good with that. So, but with time, I'm going to get us good set of cameras. I'm going to get us really nice content going on, especially when I start to share with you the exciting journey from when I passed the NCLEX till now, until in the future we're going to get to know all of that. And I believe that is going to be a source of great encouragement to someone out there, and you will not lose hope on your journey. Okay, a lot of people have asked me personally, privately, to do a video on the process, like the NCLEX process itself, like how I started before I took the exam and all of that. Like that's something that if you really want me to do, I like to see more comments about that, so that I would know if that's worth it. Because for now, I'm just focused on those who have already gotten through the process and they're ready to take their exams, to help them in one way or the other to pass their exams. So without further ado, we're going to close this session right here. And for those of you who are taking your exams tomorrow, please, good luck. God bless you. May you pass your exam. And for those of you who are taking it in the nearest future, stay tuned and let me know. I can go an extra mile to help you in any way. Just let me know how you want me to help you. As someone who has gone through this process successfully on my first try, I stand a chance to tell you some things that you might want to know. So just don't be shy, hit me up, and I'm gonna go through it with you. Thank you. Stay tuned. Bye.